Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. We have administered more than 418,000 doses of vaccine in our province. Thank you to all who have signed up for appointments and shown patience as AHS teams and pharmacies do their best to book as many eligible Albertans as they can, as quickly as possible. I am pleased to inform you that starting tomorrow morning at 8:00 a.m., AHS will open booking to all remaining birth years in Phase 2A. The booking tool will be offline for 30 minutes from 7:30 to 8:00 a.m. to prepare. And after that, again, all eligible Albertans in Phase 2A can make appointments. As well, participating pharmacies continue to book appointments for everyone born in 1956 or earlier. I would also like to remind Albertans that once you are eligible, you stay eligible. So whether you became eligible last week or last month, you can continue to book your appointment if you have not already done so, as we proceed through our rollout. Turning to today's update. Over the last 24 hours, we have identified 505 new cases of COVID-19 and completed about 10,900 tests. Our positivity rate currently stands at 4.8%. We have identified 91 new cases of the variant of concern, which represent about 12% of our active cases. Looking to schools, there are currently active alerts or outbreaks in 297 schools, or about 12% of the schools in the province. Currently, these schools have a combined total of 1,241 cases since January 11th. There are currently 264 people in hospital with COVID-19, including 43 in the ICU. Sadly, one new death was reported to Alberta Health in the last 24 hours. We continue to see fatalities declining, which is positive, but every life that is lost is devastating for those who love them. My condolences go to anyone who is mourning someone lost today. Please know that you are not alone and that there is help to support you through this difficult time. Today, I want to briefly talk about one area of Alberta where we are seeing growing rates of transmission. After a year of this pandemic, we know that COVID-19 doesn't care where we live. This virus, like any other, simply wants to reproduce and spread to as many people as possible, and no region is immune from its spread. Throughout this pandemic, we have seen cases rise and fall in various parts of the province. In the spring, Calgary Zone had the highest active case rates, and in the fall, we saw cases first rise sharply in Edmonton, followed by the rest of the province. In recent weeks, an area that has been hit hard with a rise in active cases is Lethbridge and surrounding areas. 3 weeks ago, on February 25th, Lethbridge had 19 active cases. Yesterday, the community reached 469 active cases. Cardston County and several other nearby areas have also seen a rise in COVID-19 spread. Simply put, cases are rising sharply, and we must curb the current rate of infection. While there is no single cause of the spike, local health officials have let me know that many of these cases are linked to family gatherings and visitation between households, people with mild symptoms who do not stay home or get tested right away, or faith gatherings where masking and distancing is not happening. I want to be clear that most people in this area are still doing their best to stop spread, and that the rise in cases is a reminder that the actions of a small number of people can have a far-reaching impact. I know we all miss seeing friends and family in person, but these gatherings allow the virus to spread from one to many in a matter of days. I am hearing a rise in the belief that because most people who catch COVID recover, that this means we shouldn't worry about its spread. The reality is that it is this very fact of most people having mild symptoms that makes COVID-19 so dangerous for our communities. This is because any one of us could be carrying the virus and not yet showing symptoms, passing it on to our friends and family, who then pass it on to others. If COVID-19 made most people who caught it extremely sick, this would make it much less likely to spread. As it actually behaves, it can spread like wildfire, and until we have enough vaccine to offer protection to the most vulnerable Albertans, widespread transmission would still mean surges in hospitalizations, ICU admissions, and even deaths. I don't ask Albertans to fear COVID-19. I ask us all to respect it. Many European countries are seeing a third wave in cases, hospitalization pressures, and deaths, despite being somewhat ahead of us with vaccine coverage in their populations. We are so close to having the ability to prevent these consequences with vaccine. I ask all of us not to waste the sacrifices that have been made in this past year by ignoring the public health measures in place that are still very much needed. It is essential that residents, not just in Lethbridge, but in all of Alberta, not participate in any indoor social gatherings and follow the public health orders in place. We have seen outbreaks come and go, and many different areas and communities have become hotspots at some point since this pandemic began. While it's tempting to think that one person's actions don't make a difference, or that our own community is safe from COVID-19, the numbers prove otherwise. And that's because we're all equally at risk of this virus. The good news is that South Zone, like all parts of the province, has repeatedly shown us that we can bend the curve back down. By making simple, safe choices every day and following the rules, we can break the chains of transmission and reduce spread in Lethbridge and area and across the province. It is the everyday choices that matter for all of us, and make no mistake, each one of us matters. Not attending parties or potlucks, physical distancing from anyone not in your immediate household, and staying home if you're sick. It is these small and sometimes inconvenient actions that are so important. Wherever you live in the province, these simple acts will help protect us, our families, and our communities. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Thank you. Jeff Slack, 660 News.
Hi there. Thanks for taking my question. Dr. Hinshaw, you described the next few months as basically we're in a fight between variants and vaccinations, and we've learned about mechanical issues preventing a shipment of Moderna coming in, and this morning the Premier said that now only half the shipments are coming. Also, you just announced that there are 91 new variant cases. I know a final decision hasn't been made on phase 3, but do you feel we may lose this fight if we move forward with easing more restrictions, given what's happening with variants and the vaccine supply?
We're watching our numbers very closely, and of course there are many considerations that go into making a decision about moving into step 3. Final recommendation has not yet been put forward, and final decisions have not yet been made. But I would say, as we're looking at all of our options, it's critical that we learn from other jurisdictions and that we watch what has happened in other parts of the world when variant cases have risen sharply, and that we need to factor that in as one of many considerations as decisions are made.
Is there a follow-up, Jeff?
Yeah, just a quick one. Do you feel there is a risk we could see a third wave if we move into phase 3?
What we've seen in other parts of the world is that that third wave, as it always does, really relies on or depends on, I should say, the actions of people in the population. What we're seeing right now, again, what's being reported to us when we're talking to contact tracers, is that many people are understandably feeling very, very tired of restrictions. And so I would say that what's formally in place is only one part of the equation. The other part of the equation is how willing all of us are to follow the restrictions that are in place. And I would ask all Albertans to continue to be mindful that our actions and our choices have significant impacts on our communities. And so again, whatever the framework of restrictions is, it's absolutely critical that each one of us every day is following what's in place, because when we get tired of those, when we put them aside, that's when the virus has that chance to spread from one to many.
Operator, could you put through the next caller, please?
Julia Wong, Global News.
Hi, Dr. Hinshaw. I spoke with a family today that has several members eligible for COVID-19 vaccination, but they're all housebound, unable to move or walk without help from healthcare providers. What plans are in place to vaccinate those who are unable to leave their homes?
We have been working with different ministries in the government, as well as organizations that serve seniors and others who have difficulty in mobility issues, and we're trying to make sure that people have different kinds of supports that are available to them to help access vaccine. We will be continuing those conversations, and certainly if there are individuals who are having difficulty, again, whether it's difficulty leaving their homes or if they don't have transportation readily available, those are issues that, again, we're working to try to provide options to those people and make sure that those kinds of barriers don't stand in the way from someone receiving protection. But of course, there's a variety of those kinds of issues that people have, and one solution will not fit everyone, which is why we need to work collaboratively, and we are working over the next several weeks to have meetings with a multitude of stakeholders to try to identify where those barriers are so we can come up with the best solutions to address them.
Is there a follow-up, Julia?
Yes, I recognize no decision has been made about step 3 yet, and you spoke earlier about indoor social gatherings when it came to Lethbridge's situation. But what is your advice on proceeding with relaxing rules around indoor gatherings, especially with Easter coming up?
It's critical that, honestly, whatever the rules are, that people follow what's in place. And I think what we're seeing now and what's been reported to us in many of the transmission events that have happened across the province, not just in Lethbridge, is that people are tired of the restrictions and starting to ease up. And what we're seeing is when that happens, we get spread from one to many. And so what I would say is that whatever that framework of rules is, the most important thing is that all of us look at what that framework is and make those decisions. These next few months are absolutely critical. We know that indoor social gatherings, especially large indoor social gatherings, are a very risky type of activity that enable that virus to spread from one to many. And so I really encourage all of us to think about how we can be a part of the solution over the next few months and just hold on until we can get the vaccine out to as many people in Alberta as possible so that we can protect them from those severe outcomes.
Operator, could you put through the next caller, please?
Jennifer Lee, CBC.
Hi, Dr. Hinshaw. Yesterday you mentioned there are cases here in Alberta where the variant has spread outdoors when people are not masked or socially or physically distanced. And I'm just wondering if you can provide a bit more detail on the nature of those situations. You know, what kind of interaction was going on? Were children involved or adults involved? And also, I'm just wondering if you have a sense of how often you've documented this kind of transmission.
Sure. What's been reported to me from our teams that watch the trends in our data is that when social gatherings are happening outdoors and people are, for example, in close proximity, having prolonged conversations, that kind of activity, if again they're not distanced, they're not masked, and they're having those close face-to-face conversations, that transmission can still happen. I want to be clear that outdoor gatherings are safer than indoor gatherings. However, they are not a perfect way to prevent spread. I don't have the details on age breakdown, so that's something I'd have to take back to the team and see if we have that detail to provide. But ultimately, and I've used this example before, if you think about in the winter, when you breathe out and you can see your breath, that cloud of droplets of your breath, if you think about if you're close enough with someone where in the wintertime that cloud of breath would touch them and you don't have a mask on and you're not staying distanced from them, even if you're outdoors, you can still be exposed or expose someone else if one person is infectious.
Is there a follow-up, Jen?
Yeah, thanks. I guess I'm trying to get a sense of, do you have a sense at this point as to whether you're seeing more of this with the variant? And if so, does that change your advice at all to Albertans?
I would say that we know that the previously dominant COVID-19 case could also spread in that way, again, having close face-to-face conversations with someone. And so my advice to Albertans would remain the same, which is that outdoors is safer than indoors. And if you're gathering outdoors, you still need to be mindful of distancing, masking, and trying to mitigate the risk that there could be that spread that happens. But just by moving an event outdoors doesn't completely eliminate the risk, but it does dramatically reduce it.
Operator, could you put through the next caller, please?
Thank you. Camilla DiGiuseppe, CTV Calgary.
Hello there, Dr. Hinshaw. Good afternoon. We know that a decision has not been made yet on stage 3 reopening, and hearing your message today about the virus spreading particularly more quickly in indoor and household settings, what is your advice on proceeding with indoor gatherings as part of step 3, and could it be excluded from the next phases of the process?
One of the things that, again, is really important to consider, and one of the things that we've heard from many, many Albertans, is how much the absence of social interaction, in-person social interaction, has impacted them. And as we have always done, we've been looking at the impacts of COVID-19 and the impacts of restrictions. So I think one of the things that is currently important to consider is if there was a framework that minimized the number of people or minimized the risk to allow, again, that risk mitigated type of interaction to happen, whether that would actually be better than the current state, because in some ways perhaps the current state is causing people to feel that they just can't follow the rules anymore, that the pressure of isolation is becoming too much. And so again, we have to make sure that we're not thinking about the rules as an abstract thing that will always be followed, but rather as something that we want to work with Albertans to try to reduce the risk. And if small kinds of social gatherings will help to mitigate that risk of isolation, but also minimize the chance that people may be having very large social gatherings, then that may be a pragmatic step to take. Again, no decisions have been made, but it's really important, again, that we consider the real life implications of the rules and continue to encourage Albertans as much as possible to minimize in-person interactions indoors with people outside your household.
Is there a follow-up, Camilla?
Yes, thank you. The variants appear to be a driving uptick in cases that we're seeing right now. Could you say that we are in the third wave, or when will we know if we are?
The coming weeks will really tell us that story, and we certainly are seeing some concerning early trends. I would say that a couple of weeks ago, we saw week-over-week rises in our new cases, followed by a stabilization. And so right now, again, we're in a very, very critical time, and our collective actions now will determine what we see in the weeks ahead. So whether or not our cases continue to rise in the coming weeks, again, that really is up to all of us. And we will know, I think, in the coming weeks, again, what the current interactions Albertans are having with each other, what impact that has on transmission. But I would say, again, that it is always the right time to change behavior. If people have been shifting a little bit away from following public health measures, now is the right time to shift back and make decisions that will protect our communities until we can get that vaccine on board.
Operator, could you put through the next caller, please?
Lauren Pullen, Global Calgary.
Hi, Dr. Hinshaw. Thanks for taking the time to answer my question. I'm just hoping for a bit of clarity in terms of Camilla and Julia's questions about indoor gatherings. I'm a little bit confused at the messaging here. At the end of your answer, you had asked people to still only gather with people in their households, as I know those are the rules right now. But previously, in that answer, you had also said that relaxing the rules as part of step 3 could be beneficial because some people simply aren't listening. They're exhausted with the regulations that we have had in place. Can you make it clear for us, what is your comfort level with easing restrictions around indoor social gatherings come step 3?
I think there are a lot of factors to consider, and what I was trying to articulate in the discussion about how Albertans will interact with each other was that just because something is down on paper doesn't mean that is exactly what Albertans are doing. And so that's part of those considerations as the decisions are being made and those discussions are happening around step 3 and what implications might happen. To be clear, if people are choosing to interact with others outside their household right now, that is against the rules and it is putting others at risk. However, if we go forward with a slight easing of those rules, it may help those who previously were having large gatherings perhaps to reconsider and scale those back. So again, it's about trying to do our best as we're considering what framework to put in place to meet Albertans with the path that we are most likely to collectively be successful at. But whether or not this is something that is put in place as a framework, I would continue to advise Albertans, especially if we see variant cases continue to rise, to think twice before having a gathering with someone outside your household. And again, if people are feeling isolated, as I know many are, consider having that gathering outdoors where even though the risk isn't zero, it is greatly reduced. So I recognize that it's not black and white, but that's because the reality is, again, that people need to make decisions in complex environments, and we're trying to set the rules in a way that helps most people be able to follow them most of the time to reduce our overall risk of transmission.
Is there a follow-up, Lauren?
Yes, thanks for that clarity, Dr. Hinshaw. I just wanted to zero in a bit more on those variant cases. 91 is the highest that we've seen in a daily turnaround. Can you take me through your level of concern in the rises that we are seeing?
What we're seeing is an overall increase in cases and slight overall increases week to week in the proportion of all of our cases that are caused by variants of concern. And so again, I am concerned about this trend. We are seeing, as I mentioned in my speaking notes, some particular areas of the province that are having a particular growth, but we know from earlier experiences that that can spread to other areas of the province if we don't collectively make decisions to reverse that trend. So the rise in variants, the rise in cases, both of those are concerning, and we do need to continue to watch those and use that information to help all of us make decisions about what we do every day.
All right, there's one final question in the queue. Operator, please put through our final caller.
Thank you. Sarah Williscraft, Fort McMurray today.
Hi, Dr. Hinshaw. Thanks for taking my question. The Recreation Center at McDonald Island Park here in Fort McMurray is requiring people to doing low-intensity exercise in its pool to wear masks. I'm just looking to ask you if this is something that's necessary.
With the current framework in terms of physical activity, if there are groups of people doing low-intensity physical activity together, then masks are required. And so there are some activities perhaps that happen in pools where people do not have to put their faces in the water. And so we're really leaving it up to operators of those types of programs to determine if that can be safely done. Certainly, if it can't be safely done, then those types of group activities should not be happening at this stage, because right now the requirement is, again, that masking helps to mitigate the chance that there could be spread within that group, even with low-intensity exercise.
Is there a follow-up, Sarah?
No, I'm okay. Thank you so much.
Thank you all for joining us. Dr. Hinshaw will provide another update on Monday afternoon. Have a safe weekend.